about your goals and also your limitations. For example, if your goal is to simply be healthy and to have cardiovascular fitness, then aerobic exercise is one of the best things that you can choose. If you're limited by an injury, for example, a lower body injury, you might consider something like swimming, where you don't have to use your legs in a weight-bearing position. So really what you want to do is think about your goals. Do you want to be strong? Do you want to be simply healthy? Do you want to have aerobic fitness? Do you want to have flexibility? And then you can choose your exercise based on that. I think it's very important to prevent injury, and the reason that we see most injuries is because of overuse. And a lot of times when you're starting a new fitness program, there's a temptation to get out there and give 110%, and then it's more easy to get injured. So what happens is you need to start off fairly slowly and work up. Don't increase your intensity or your length of exercise more than 10% per week, and that will help you prevent getting injured. Also make sure to use the proper equipment, proper shoe wear, especially for things like running or other athletic exercise. Shoes don't always correlate from one sport to the next. If you're going to be a runner, you want to get a good running shoe. If you're going to play tennis, you want to get a tennis shoe. That sort of thing. Actually, many people think that you can't exercise if you have an illness or an injury, and one of the big things that we're trying to promote is that anybody can exercise no matter what your limitations, no matter what your injury. And for example, let's say that you've gotten a stress fracture in your foot. You can't run, but actually you can typically ride a stationary bicycle, you can swim, you can do other upper body strengthening exercises, and the key is to not stop all exercise once you've had an injury. You need to find simply which exercise you can do. Arthritis is one of the most common illnesses out there in the U.S., and many people have knee arthritis or hip arthritis and really have trouble with even things such as walking. And so I have many patients come and tell me, I wish I could exercise, but I have arthritis, my knees hurt, my hips hurt. And really they can exercise, but the most important thing that they have to do is find an exercise that is low impact. Actually, moving your joints that are arthritic is very helpful for the joints. Motion is very good. It's just the impact that isn't good. And so what you need to do when you have arthritis is pick an exercise or activity that involves movement of your joints, but not high impact. So for example, water aerobics is a great exercise. Swimming is a great exercise. Biking is a great exercise. Even if you don't like any of those activities, you're a runner, you love to run, but you can't run because your joints hurt, try an elliptical trainer. That way you can get the same motion and the same type of workout as with running, but less impact. I think the most important thing when you're talking about exercise for kids is finding something that they like to do. Sometimes kids get sort of pigeonholed into one single sport and they exercise just in that sport. And I'm a real fan of multiple sports and free play for kids. Just let them run around outside. They'll figure out what they need to do. And I think that it's very important not to have kids in one sport all year round with no breaks. It's very important to give them a break. Not that that break should involve sitting on the couch and playing video games, but that break should involve some other type of play or type of activity that's not so rigid and structured. Some of the most common injuries that we see in kids are actually simple abrasions, cuts and scrapes, contusions or bruises, and those are fairly easily treated. Occasionally we'll see more serious injuries, sprains and strains, even fractures in kids. And I think it's important for adults to look at your kid, watch them. They may not come to you and tell you, I'm hurting while I'm playing a sport. So what you have to do is look for things like a subtle limp or a change in the way that they do their sport. And ask them, are you hurting? Sometimes they're so competitive, they'll say, no, I'm not hurting. So you've got to look for things like swelling in the joints, tenderness and palpation, again, changes in the way that they're playing their sport, if they're changing their form, if they're limping, any of those things should